All right, Ninja Nerds, in this video we're going to talk about the thoracic abdominal circulation. Okay, so what we're going to try to do in this video is we're going to go through, taking here the diaphragm, separating the thoracic aorta from the abdominal aorta. We have a blank diagram like this set up on our Instagram page. So if you guys go on our Instagram page, you guys can actually have this as a template to kind of follow with me as I go through this, okay? Also, if you guys just want to pause the video, and take some time to draw this all out, you guys can, and then come back and we can actually go through this together. All right. So we're going to start up here first with the thoracic aorta, okay? So let's say we start here first with a thoracic aorta, and you can tell that because the thoracic aorta is the large vessel that's going to be above or superior to the diaphragm. This green line here is supposed to represent the diaphragm. So superior to the actual diaphragm is going to be this large artery here called the thoracic aorta. It's a part of the descending aorta, which is coming off the aortic arch, okay? So this is called our thoracic aorta. All right, now, off the thoracic aorta is many different types of vessels that come off of it, okay? So for example, the first one to come off of this, we could say there's many of them. Let's say that we go with this one. There's actually a vessel that comes off the aorta and it goes and supplies in between the ribs. So when it goes in between the ribs, it's actually called an intercostal artery, and it's on the posterior side. So it's actually called the posterior intercostal artery, okay? And you have many of these. So the posterior intercostal arteries are going to be those arteries that are running in between the ribs, so they're supplying the external internal intercostals, okay? Also, we have a vessel that actually can give a branch right here to the actual diaphragm. So this is actually going to give an actual branch right here to the diaphragm and supply the actual muscles there. So this would actually be called it's a phrenic artery. So it supplies the actual diaphragm, but it's above the diaphragm. So we call it the superior phrenic. Okay, so this is called the superior phrenic artery. Okay, so there's our superior phrenic. Then if we come over here, we have other branches that are going to different parts, okay? So let's say that we do with this first one up here, and we say this is for the bronchial arteries, okay? So this is the bronchial artery. So this is going to go and supply the bronchi. So it's going to supply the bronchi. It's going to provide oxygen-rich blood to many of the different cells within the bronchi. Most of these arteries are going to be pretty simple because if you think about it, it tells you what it's serving. So it's not super complicated to understand that, right? Okay, so next one, let's say that we go a little bit, near that, we have the esophagus. So we have the esophageal artery. Okay, so then we have the esophageal artery. You already know what it does, it supplies the esophagus. So simple stuff here, and then we could have another one. There's an actual cavity located within inside your actual thoracic cavity. It's called the mediastinum, houses, the actual heart. And then we're going to have other structures in that area like the thymus gland. You can even have the esophagus, a lot of different types of lymphatic structures within that area. There's going to be an artery that supplies that, and that's called the mediastinal artery. So the mediastinal artery. So it's going to supply mainly, the main structures that it does supply is it supplies the actual lymphatic structures within that area, like the lymph glands, so the thymus gland, as well as some of the areolar connective tissue within the posterior aspect of the mediastinum. Okay, so that's our mediastinal artery. Then you also know that there's actually a fibrous tissue that's surrounding the actual heart. It's called the fibrous pericardium. The pericardium has to get his blood supply too. So there's also what's called the pericardial artery, right? So the pericardial artery. So that's the pericardial artery. And again, that's going to supply the actual dense fibrous irregular connective tissue like the fibrous pericardium. Now, here's the thing. So thoracic aorta, if you're actually looking inside of the actual thoracic cavity, obviously you guys watched the anatomy video. A little bit of orientation for you. If you look at the thoracic aorta, you obviously know it's within the thoracic cavity. If you imagine you have your vertebral column, that's going to be right behind it. So posterior to the actual thoracic aorta is going to be the part of the vertebral column. Also, it's going to be very close. So to the left of it, you're going to have the left pleura of the lung, okay? Also, right behind it also, besides the vertebral column, is what's called the hemiazygous vein. We'll talk about that when we look at more vessels within the thoracic cavity. Okay? Now, on the actual left of it, you're going to have other structures. So we said there's going to be the left pleura. Okay? Also, you're going to have on the right of it, you're going to have the thoracic duct. Okay? So you have the thoracic duct, you have the azygous vein. There's a lot of different structures that are going to be nearby the thoracic aorta. Okay? So that's the thoracic aorta vessel. So again, we covered the bronchial artery, we covered the esophageal artery, we covered the mediastinal artery, the pericardial artery, the posterior intercostal arteries, and again, that will be a left and a right. and then the superior phrenic artery, which again will be a left and a right. Once the thoracic aorta pierces through the actual diaphragm, it comes out as a different type of part of this aorta. It's still descending, it's still going down, but now it's located within the abdominal cavity. So now it's called the abdominal aorta. Okay, so this is called your abdominal aorta. Now, abdominal aorta is very cool because, as you can see, there is a boatload of branches that are coming off of this bad boy. So let's go ahead and go through some of the easy ones first, and then we'll go over to ones that have more branches. All right, so first thing, you know how there's a superior phrenic artery supplying the top of the diaphragm? There's one that's supplying the inferior part of the diaphragm, right below it. So this guy can actually supply the inferior aspect of the diaphragm. So it's called the inferior phrenic artery. Okay, so this is called your inferior phrenic artery. All right. Then, got a little hints for you guys. If you guys look here, this is actually going to be what? Your adrenal gland. So your adrenal gland is actually going to have a blood supply. Now, you can actually name it two different types of names. Okay, so you can call it the adrenal artery. And again, you have two adrenal glands. So one on the right side, one on the left side. So you can have a right and a left adrenal artery, or you can call it a right and a left suprarenal artery, since it's above the kidneys. It's up to you guys. I'm just going to write adrenal because it's less to right. All right, so right and a left adrenal artery. Okay, same thing with the inferior phrenic artery. There's going to be a right and a left inferior phrenic artery. Okay, now you have the kidneys. Right inferior to the actual adrenal glands, or the suprarenal glands, is going to be your actual kidneys. So these are, you're not going to call them kidney artery, though. You call it the renal artery. Okay, so specifically you have a right and a left renal artery. So you're going to have a right and a left renal artery. All right, and then you can obviously tell that this is going to be representing the male gonads, so this is going to be the testes, and this is actually going to be for the actual female gonads, or the ovaries, right? So this is going to be the gonadal arteries. Simple as that. But if it's in a male, you would call it the testicular arteries. If it's in a female, you would call it the ovarian arteries. Simple as that, okay? But we're just going to call it, in this case, we're going to call it the gonadal arteries. The gonadal arteries, okay? And again, there would be a right and a left. Then you're going to have other ones that are going in with the lower part of the actual abdomen. So as you get lower, you have what's called the cervical vertebrae, then you have the thoracic part, then you have the lumbar part. You have arteries that are specifically coming off the lower part of the abdominal aorta going to supply the lumbar region, so some of the muscles within the lumbar region. Okay, so this is going to be the lumbar artery. Okay, so it's our lumbar artery. All righty. And again, you'd have right and left there. All right. Now, as we keep going forward, let's say that we get down. As we go down the abdominal aorta, it begins to split. So there's a branching point of it. So as you get ready to split, there's this big, big branch. Let's say that we have, just to be consistent, let's say that this is going to be the left side and this will be the right one. So for example, this will be the left common iliac. So I'm going to put left common iliac artery. Then, left common iliac artery can branch, okay? So he can branch into an external branch and an internal branch. If it goes to the external branch, we'll cover that one in another video. So I'm going to write down here specifically the left external iliac artery. But we're not going to talk about his branches in this video. We will in another video when we talk about blood flow to the actual lower limbs. Okay? Specifically, we're going to try to focus on within the thoracic region, the abdominal region, some of the pelvic region. All right, the other branch of the common iliac artery is not just the external, but there's also the internal. So this would be the left internal iliac artery. Okay? And this one has many branches. Okay? So you got the booty. You got the superior gluteal muscles, right? So the superior gluteal artery. So you have what's called the superior gluteal artery. Now the superior gluteal artery supplies a couple different structures. So it mainly supplies the actual gluteus maximus, okay? It can supply another muscle underneath that, which is called the gluteus medius and the gluteus minimus. So I'll write that down here on the side. So this can supply the actual gluteus maximus. It can supply the gluteus medius and minimus. Okay? So those are some of the muscles that this actual artery can supply. All right? Then you have one that's going to be a little bit below that. So it's an inferior. So it's the inferior gluteal artery. The inferior gluteal artery. Now the inferior gluteal artery, similar, it does supply the gluteus maximus, but it also supplies that other different branch. You know, see actually underneath the gluteus maximus, there's literally these muscles called, it's called the piriformis muscle, and you also have another one called the quadratus femoris, not the quadriceps, the quadratus femoris. So this is going to supply that structure. So the inferior gluteal artery is going to be specifically supplying the gluteus maximus, but not as much as the superior gluteal. It's going to supply the piriformis, and it's also, like we said, going to supply the quadratus femoris. The quadratus femoris. All right. You then have another one. It's called the internal pudendal artery. Okay, so you have what's called the internal pudendal artery. Okay, now the internal pudendal artery is specifically going to be supplying the external genitalia. Okay, so for males it actually supplies the actual penis, specifically within the penile arterioles for the erection, and it also can supply some of the actual external genitalia for the female, maybe the clitoris as well. So it supplies the external genitalia as well as the perineum, which is the space between your anus and your actual, specifically the gonads. But for the male, you would say it's the actual space in between the actual testicles, right, and the anus. Whereas the female, it would be also the space between the actual vaginal canal and then also between the anus, okay? So it's going to supply those structures. So again, it's going to supply the external genitalia as well as the perineum. Okay, then you have the last one, and this is going to be the obturator artery. Okay, so the last one is going to be the obturator artery here. And the obturator artery is a cool one because it supplies mainly what's called the medial compartment of the thigh. Okay, so it supplies the medial compartment of the thigh. The medial compartment of the thigh. So a lot of different muscles that this guy can supply. So if you think about it, he could supply some of the actual adductor muscles. Okay, some of the adductor muscles. Alrighty, so we got that. Let's do a quick review on this side and then we'll keep going over here. So again, we got off the abdominal aorta, you got the inferior phrenic artery, which supplies the actual inferior portion of the diaphragm. You have the right and left adrenal artery, which goes to the adrenal gland. You have the right and left renal artery, which is going to the kidneys. You have the gonadal arteries, which is going to the actual testes in the males and the ovaries within the female. So again, you could call it the actual testicular artery or you could call it the ovarian arteries. You have the lumbar artery, which is supplying some of the muscles in the lumbar region. Okay, many different muscles in that area. Then you have branches. You have these branches coming off the abdominal aorta. You got the left common iliac and the right common iliac. If we follow this for a second though, the left common iliac can branch into the left external, which we'll have another video on and discuss all the vessels that it continues on as, like the femoral and so on and so forth. And then the other is the internal iliac, right? And that gives way to the superior gluteal artery, which supplies the gluteus maximus, the gluteus medius, and the gluteus minimus. The inferior gluteal artery, which supplies the gluteus maximus, the piriformis, and the quadratus femoris. The internal pudendal, which supplies a lot of the external genitalia and the perineum. And then you have the obturator artery, which is supplying the medial compartment of the thigh. Okay, so some of the adductor muscles. Okay, so to continue on, I told you here that imagine here's the abdominal aorta, it branches. When it branches, it gives off a left common iliac and a right common iliac. But you guys already know what this is going to be. So right common iliac artery. And the right common iliac, it branches. So it's going to give away to a external iliac and an internal iliac. It's just going to be right. So again, in this case, it's going to be right external iliac artery. And this is going to be the left external iliac artery. Sweet deal. Okay, so let's come back up to this top point and we'll go back towards the middle, okay? So it's going to be a lot of branches here, so just hang in there with me, okay? So off the abdominal aorta, you have this huge trunk, okay, a trunk coming off of the abdominal aorta. It is called the celiac trunk. So they call it the celiac trunk or the celiac artery. We're going to call it here the celiac trunk according to the literature that we're following, right? So the celiac trunk. Now off of the celiac trunk, there's going to be 3 branches that are coming off of this, okay? So the easy one is it's actually one's going to come right off of it. It's the left gastric artery. So you can imagine what the left gastric artery is going to supply. It's going to supply the stomach. Okay, so left gastric artery. Okay, now that's one main branch off the celiac trunk. The second branch is the splenic artery. And you know that the spleen is normally going to the left side, unless you have situs inversus, totalis, right, which it actually would switch. And in that case, the spleen would be on the right. But we're not talking about that. We're talking about normal individuals. So yeah, in this case, you're going to have the splenic artery going to the left side. So we don't even say left because there's only a spleen on the left side. So this is the splenic artery. Okay. Now the splenic artery has different branches. We're not going to go into tons of them. We're just going to talk about one of the main ones. Off of the splenic artery, since it's going to the left side, our stomach has, imagine here's our stomach for a second. Imagine here's our stomach. We'll talk about this more in the GI anatomy. But you have what's called the greater curvature of the stomach. Hanging off of the greater curvature is this actual, what's called a mesentery. But they call it an omentum. It's called the greater omentum. Okay? Now what happens is this splenic artery gives off a branch that goes and supplies the actual omentum, the greater omentum, as well as some of the actual stomach. So that is called the left gastroepiploic. Sometimes they call it the gastroamental arteries too. But we're going to call it here the gastroepiploic. So specifically, this is the left gastroepiploic artery. I'm surprised I even spelled that right. All right, so left gastroepiploic artery. All right, now you got the splenic artery giving way to the left gastroepiploic artery. And again, what is it supplying? Just so we remember, when you hear this word gastroepiploic, you can also remember gastroomental, meaning it supplies the stomach as well as the greater omentum, which is a mesentery. Okay, mesentery is just a double-layered epithelial membrane. Okay, and that double-layered epithelial membrane is where a lot of blood vessels, lymphatic fibers, nerves run through. Okay, now we go into this big old beast. All right, so we got the left gastric splenic artery. Now we got this next one. This next one is called the common hepatic artery. Okay, so this is called the common hepatic artery. Now, if you noticed, usually every time you hear the word common, it's going to be splitting. Okay, it's usually going to be branching out into different parts, and that's what this one does. So one of the branches here, off the common hepatic artery, let's go this way here first. This is actually going to be called the hepatic artery proper. So obviously you know that this is going to be the hepatic artery proper now. And again, some people will be like, oh, is it the right or the left? Hepatic artery proper is just saying that it's actually going to the liver. And normally, in normal individuals, the liver is usually always on the right side. So we don't have to say right hepatic artery proper. We just say hepatic artery proper because there's no liver on the left side. All right? So you call this one the hepatic artery proper. Why they put artery before the proper, no idea. You can probably call it hepatic proper artery. You know, it doesn't matter, just as long as you got that point there. All right? The hepatic artery proper then gives off a couple different branches. So one of the branches is going to go to the right lobe of the liver, okay? So if it goes to the right lobe of the liver, it's the right hepatic artery. So one is going to be the right hepatic artery. And then eventually what happens, we'll talk about this more in the GI physiology, but specifically this is going to go to what's called a liver lobule, where it's going to actually undergo specific types of, it's going to provide oxygen and nutrients and different types of substances to the hepatocytes, the liver cells within the actual liver. Within the liver lobule. All right. Now, you have another one which is going to the left lobe of the liver. Okay, so you have the right lobe of the liver, left lobe of the liver. This is going to be the left hepatic artery. So this is called the left hepatic artery. All right, sweet deal. Now, another thing. So we had a left gastric artery coming off of the celiac trunk. Now, since the liver is on the right side, it provides a branch that can go over and supply other parts of the actual stomach. So you know over here, we said that specifically you had the, You had the gastroepiploic artery, which is supplying branches here to the omentum and even maybe the greater curvature of the stomach. Then you're going to have the left gastric artery, which might be supplying this fundus part here. The right gastric artery is mainly going to be supplying the pylorus. Okay, so it's going to be supplying a lot of the pylorus region there, and maybe even parts of the body. Okay, so specifically, this one is going to be the right gastric artery. So right gastric artery. And again, the right gastric artery is also going to be supplying the stomach, more along the lines of the pylorus and even the parts, what's called just the body of the stomach. Okay. Then, common hepatic artery not only gives off this branch, but it also gives off another branch. This other branch here is called the gastroduodenal artery. Okay. So off of this one, we're going to have another one, which is going to be called the gastroduodenal artery. So let's write this one down here. So it's called the gastroduodenal artery. Okay, so gastroduodenal artery. Now the gastroduodenal artery, you can obviously recognize what this is going to be supplying. So imagine here's my stomach, okay? And you're going to have what's called this fundus region, the body region, the pylorus, and then you have the first foot of the small intestine. This artery, this gastroduodenal artery, is mainly supplying the pylorus, the in part of the stomach, and the first foot of the small intestine, which is called the duodenum. Okay? So that's what the gastroduodenal artery is supplying. It's mainly supplying the pylorus of the stomach, as well as the first foot of the small intestine, which is called the duodenal. Okay, the duodenum. So this is called the gastroduodenal artery. Now, the gastroduodenal artery can split, okay, and it can supply other regions also. So off of this one, it's going to give a branch. This is going to go, okay, now, if you imagine here, say I draw another part here. Let's say I have here for a second, I have the stomach, the duodenum there, and again, you had this omentum here, right? But you also have a lesser curvature with some omentum over there too. This is where the right gastroepiploic artery comes in. So the right gastroepiploic artery is going to supply some of this actual lesser omentum. Okay, so that's going to be this branch here. So this branch right here coming off of the gastroduodenal artery is specifically going to be the right gastroepiploic artery. Okay, so mainly supplying some of the actual, again, it supplies the stomach. It does supply the stomach region, but it's also going to be supplying some of that actual lesser omentum, which is a mesentery coming from the lesser curvature and anchoring it to what's called the liver. Okay, then we have another branch. Another branch here is going to be what's called the superior pancreatic duodenal artery. Okay, so this one right here is called the superior pancreatic duodenal artery. Okay, that's a big old beast. So the superior pancreatic duodenal artery. Okay, so now the superior pancreatic duodenal artery. So let's say here just for a second here, so that we understand orientation. Let's say here's the stomach. Okay. And then you're going to have, again, that first foot of the small intestine, which is your duodenum. Right around that area, you're going to have the pancreas. Okay. You probably saw this in the model that we had, right? So here's the pancreas. This is obviously a quick, crude diagram, but what happens is, coming off the gastroduodenal artery, the gastroduodenal artery is going to give out this branch right here. One's going to be the gastroepiploic artery, which is going to be supplying this actual, again, what is this omentum here? Lesser omentum. Then it is also going to supply some of the stomach, but it's also going to go off on another branch. So it gives off one branch, which is going to come over here and supply what? It supplies the pancreas, some branches to the pancreas, as well as going to supply parts of the duodenum. Okay, so that's the superior pancreatic duodenal artery. So again, what does it supply? You can obviously see it within its name. It's supplying the actual superior aspect of the pancreas as well as the beginning parts of the duodenum. That's it. Okay, now we come over here to another branch. So we covered these big branches. Now we're going to go to some of the other, slightly a little bit more, difficult branches. Okay, coming off the abdominal aorta. So if we kind of go in an order, we went celiac trunk. Right after the celiac trunk is going to come this next big vessel, which is called the superior mesenteric artery. Okay, so if we're going down, so again, you got celiac trunk, which I should be down here in the actual abdominal cavity, sorry. If we go here, we have the celiac trunk. Right beneath that is going to be the superior mesenteric. And then right beneath that is the inferior mesenteric. Okay? we're going to talk about this one here. So this is the superior mesenteric. This one will be the inferior mesenteric. So superior mesenteric artery. Okay? So the superior mesenteric artery is going to be doing what? It's going to give off many, many, many branches. It supplies most of our intestines. Okay? So one of the big ones, it supplies the actual small intestines. So it supplies it through what's called the intestinal arteries. So the intestinal arteries are going to be going and supplying what's called the jejunum and the ileum. Now the jejunum and the ileum is a little bit different. So if we actually for a second here, let's say we take for a second here, we go through just real quickly the parts of the actual small intestine. So the small intestine has 3 different parts, okay? First part is the duodenum. The next part is the jejunum. And the next part is the ileum. The intestinal arteries here, which are coming off of the superior mesenteric artery, are mainly going to supply more of the jejunum and the ileum, but it does supply a little bit of the duodenum, okay? So again, the actual intestinal arteries are going to be going and supplying the jejunum and the ileum mainly these 2 guys here, okay? But just a little bit of this one, a little bit of the duodenum. All right, so that's the intestinal arteries. Then, if we keep going, if we actually go to a different part now, so now we go into this next part. We have another part of our actual intestine. So now let me make another quick diagram. Let's say here for a second I have my appendix. Then I have what's called the cecum, which is attaching to the appendix. And then I go up, I have the ascending colon. I got the transverse colon. I go descending colon here. I go S-shaped sigmoid colon. And then I go into the rectum, and then I go anal canal, okay? Specifically, this superior mesenteric artery is supplying a lot. It's supplying this part here with the actual cecum right here, and it's also going to supply a little bit of the actual ileum, okay, the small intestine part of it, and it's going to supply a little bit of the appendix. This one right there, that part right there is called the ileocolic artery, okay? So we're going to call this one the ileocolic. Ileocolic artery. Okay, so that's the ileocolic. It's going to supply some of the cecum, it's going to supply a little bit of the appendix, and it's even going to supply a part of the ileum, which is actually the last part of the small intestine. The next one is going to supply this ascending colon. So, okay, so now you're going to have this part here, a branch that's actually going to be supplying a lot of the ascending colon. So if it's supplying a lot of the ascending colon, this specific branch here is actually going to be it's on the right side, so it's called the right colic artery. Okay, so this is the right colic, mainly supplying the ascending colon. So this is called the right colic artery. Then we have another part, and that's going to be this part here, the transverse colon. So supplying the actual transverse colon here is going to be this branch here. And this branch here is going to be specifically coming from the middle colic artery. Okay, so this is the middle colic. Okay, this is the middle colic. So it supplies the actual transverse colon as well as what's called the transverse mesocolon. Okay, so again, one more time. Superior mesenteric supplies the intestinal arteries, which gives way to the vessels of, it supplies the duodenum, the jejunum, the ileum, a little bit less on the duodenum. Ileocolic, which is supplying the actual cecum, the ileum, which is the last part of the small intestine, and the appendix. The right colic, which is supplying the ascending colon. The middle colic, which is supplying the actual transverse colon, and what's called the transverse mesocolon, which is like a mesentery. Okay, good there. Then we go into the next part. Okay, now we go into what's called the inferior mesenteric artery, which is again lower, okay, lower down. So now we go to this one. Inferior mesenteric artery. Okay, inferior mesenteric artery is a cool one too. So he's going to supply other parts. So let's actually have this, let's come back to this intestinal drawing we have over here. So if we come back over here, we said we had the descending colon, sigmoid colon, which is S-shaped, and we have the rectum. So if we look here, let's say we do this one in a different color now. There's branches that are going to supply the descending colon. And it's not that bad if you think about it. Descending colon normally should be on the left side. So what should this one be? Left colic. Okay, so this one should be left colic. We'll write that over in a second. Then we have another branch here, and that's supplying the sigmoid colon. What do you think that one's going to be? Sigmoidal artery. And we'll write that over in a second. Okay, and then we have another one over there, which is going to be supplying the rectum. So if you have this branch here, which is going to be supplying the rectum here, this is actually going to be called the superior rectal artery, which gives way to a mid and inferior rectal artery. Okay, and we'll write that down over there. So again, really quick, left colic is supplying the descending colon, sigmoidal artery is supplying the sigmoid colon, superior rectal is providing the actual rectum, and it gives branches to the mid and inferior rectal arteries. All right, so let's write those over here. And we'll just recap them as we're writing them. So again, inferior mesenteric artery gives way to the left colic artery, gives way to the sigmoidal artery, and it gives way to the superior rectal artery. Okay, and the superior rectal artery gives off to two branches. One is the mid part of it, so the mid rectal artery, and the other one is actually going to be the inferior rectal artery. All right. We did a great job, guys. All right, I hope all of this made sense so far. Now I want to cover one more thing, one more kind of relevant tip here. Since we're talking about the aorta, there is a condition, and we probably talked about it in other videos too with the tunic layers. There's a disease that is actually very, 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 very dangerous because it can affect this whole aorta, primarily the entire descending aorta. That condition is called Marfan Syndrome. Okay, it's called Marfan Syndrome. And Marfan Syndrome is an autosomal dominant disorder. It's an autosomal dominant disorder, and it's usually due to the mutation, okay, in a gene that produces fibrillin. So it's a mutation in what's called the fibrillin gene. The fibrillin gene is important because fibrillin is a very important elastic connective tissue. So it's a mutation in fibrillin gene. And what happens is fibrillin is very important within the elastic connective tissue. So it controls the ability for the aorta. What is elasticity? Well, by definition, elasticity is not what most people think. They think it's just, oh, you can stretch it. No, elastic means it can stretch, but it can recoil. So more specifically, it wants to resist any changes in the deformation of a structure. So if you're actually lacking this fibrillin gene, what happens to the elasticity of these vessels? It decreases. So there's a decrease in the elasticity of vessels. They can't take on as much pressure as they could normally. And what happens is, due to this situation, the actual blood dissects in between certain layers of the actual aorta, specifically the thoracic and abdominal, more common within the abdominal. And in this situation, if it happens, this can cause what's called an aortic dissection. Aortic dissection. And what's really bad about aortic dissections is that if it happens, sometimes this can actually rupture. And if they rupture, that's very, very dangerous. Another thing that can happen besides the dissections is they can actually dilate. They can become very, very dilated region. So it can cause aortic aneurysms. And if this can again lead to rupturing. And this is one of the big, big dangers of Marfan syndrome, because if that ruptures, oh my goodness, there's going to be a lot of blood that's going to be lost, and you're going to go into hypovolemic shock, and this person is not going to last very long if that happens. So another thing, since we're here talking about Marfan syndrome, not only does it decrease the elasticity of these vessels, fibrillin is not just important within blood vessels, it's important in a lot of different structures. It's also important within our heart valves. So in certain individuals who are actually having this mutation in the fibrillin gene, they have very, very increased incidences of what's called mitral valve prolapses. So their valves actually blow back into the atria, okay, and this actually can cause regurgitation issues. So in this situation, not only do they have increased incidences of aortic dissections and aortic aneurysms, but they have increased incidences of mitral valve prolapse, okay? And this is very, very dangerous because over time this can cause a lot of problems. and it might have to be repaired. Usually with Marfan syndrome, the more dangerous effect is on the cardiovascular system, but it also does affect other systems. If you notice anybody who has Marfan syndrome, their fingers are freaking yay long. They got long, long fingers, really, really thin. They're very tall, very, very tall individuals, and they're very slender. Okay, not just that, they can actually do a test usually. Usually if they do the test, they take their actual thumb. I'm gonna use this thumb because this thumb's all nasty. If I take this thumb here, usually they close their hand and their thumb pops out of the side. That's one of the things that they actually see in Marfan syndrome. So they have very, very long fingers, okay? Also, since they're not having this fibrillin, they don't have as much, again, what is elasticity? It wants to resist the change in deformation. What happens? These individuals, they actually are hyper-reflexive, and they can stretch their skin out. Okay, so they can stretch their skin out a lot, and their actual joints are very, very hyper-flexible. Another thing is, because it's affecting connective tissues, another thing that you'll see within Marfan syndrome is in the eyes. Their lens. There's these things called these ciliary zonules or suspensory ligaments. Whenever this actual fibrillin is deficient or mutated, it can't hold on to the lens, and the lens dislocates. So it can also cause lens dislocation. Lens dislocation. And usually it's a partial, so they call it a subluxation of the lens, but it's a lens dislocation. And since we're doing that, again, we said that it could have, very tall, okay, and also we said slender, long fingers, and then also very, very flexible, highly flexible. So we'll say very, very flexible. Another thing that can also affect, one of the really, really dangerous ones if it happens, this usually happens in a lot of the patients, large amount of the patients. I think about 90% of the patients usually develop this. It's called dural ectasia. It's a very unfortunate condition, dural ectasia. And dural ectasia is, you have what's called a dural sac around the lumbar and sacral region of the spinal cord that surrounds it. And usually due to this situation, because of they actually have changes in a lot of the skeletal system. Usually they have scoliosis. So you can remember scoliosis. If I draw like a little individual here, over here we can say, let's say here I have a guy here, and here he is. He's looking at you, and he's smiling, right? Okay. Here's this guy. If you look in the back of him, so let's say we look at his spine. His spine is actually going to look like this. Okay. So this is this guy here, okay? And if you kind of remember that by this S-like shape structure, that's scoliosis. So they have increased chances of developing scoliosis. And while we're mentioning that also, you can see their chest is caved in. They have a caved in chest. And whenever they have that caved in chest, it's called pectus excavatum. Okay, pectus excavatum. All right. So again, with Marfan syndrome, a lot of these things can happen. Also, if you want to, we can add in one last thing in here. It's not as common, but their lungs, they can actually have what's called a spontaneous pneumothorax. Okay, so they can develop a situation in which they can actually have pneumothorax air, which is located within the actual, specifically the cavity there, within the pleural cavity, and it can actually accumulate so much that it can actually push in the lungs and collapse them. So this is called a pneumothorax, and it's usually spontaneous. Okay. All right, and if you guys wanted to know, Abraham Lincoln actually had this disorder. I didn't know if you care too much about that, but anyway, that's Marfan syndrome. So again, knowing specifically this flow is important, but also knowing what can happen if this actual vessel, this huge abdominal aorta or thoracic aorta, is affected by some type of condition like Marfan syndrome. All right, guys. So what I'm going to do is I'm going to step out of frame, and I want you guys to just, if you guys want to, take a picture maybe, pause it, write everything down, just so that you guys have everything ready for you and you guys know exactly what to write down in this flow. All right, so I'm going to step out for a little. All right. All right, guys, I hope you guys enjoyed this video. I hope it was. It was really cool. I enjoyed doing this video. I hope it made sense to you guys. I hope you guys really did like it and enjoy it. If you guys did, please hit that like button, subscribe, put some comments down in the comment section. We really look forward to hearing from you guys. All right, Ninja Nerds, until next time.